Okay, here we go. Good morning, everybody. A very happy Wednesday to one and all. It feels like an age since we haven't all been together, or have all been together, I should say. I've been missing in action for a little while, but there's been plenty going on, lots of things changing, lots for us to talk about. So it's going to have been worth the wait, I hope. Whilst we're just letting people in, could somebody drop a 1 in the chat just to let me know that I'm not stood here talking to myself and the sound is working and everything is as it should be? Oh, thank you, Alex. Thank you very much. Anybody else? Come on, guys. This is going to be a lively one today. There's going to be lots of interaction, so we're going to need fingers on the buzzers ready for action. All right. And speaking of which, in fact, I am feeling the cold. Oh, good morning, Sarah. Thank you for that. A little hi from her. And some ones in the chat. Love it. Right. We're going to have some quick fire questions, I think, this morning, just to get everybody warmed up. I'm feeling the cold. I don't know about you, Max. Are you feeling a little chilly over there?
I'm feeling a little chilly. I've got my autumn jumper on, Lucy.
Yes, it's time, isn't it? It's time. The thermals might have to come out soon as well. Don't get me started. Anyway, right. Quick fire questions. So a 1 in the chat, please. If you have already in your practice trialed and used and played with an AVT solution, an ambient voice technology in your practice. Thank you, Sanjay. Anybody else? This is quick fire for a reason, guys. We're going to move on quickly. So, okay, Paige, yeah, great, thank you. A few people joining late, throwing me off my game, but we'll keep going. Hey, Liz, nice to see you. All right, a 2 in the chat, please. If you have read anything or seen anything about the Great Ormond Street Hospital-led trial of Tortoise AI scribe technology that led to, and I quote, transformative benefits for patients and clinicians across London. Any 2s in the chat? My gosh, has that just gone quiet? No 2s in the chat? No. Oh, okay. Well, guess what, guys? I've very conveniently got a little link here to share with you. So we'll get started with that. We'll park that one. You can come back to it later. 3rd question. If you know about or have already signed up for our free 3-month trial of Surgery Intellect powered by Tortoise, pop a 3 in the chat. A 3 for 3. Anyone? Okay, Joe, yes. Thank you. You win a prize. Don't know what it is other than my internal love, but anybody else? Any more 3s in the chat? Goodness gracious. Well, guess what, guys? I've got another link for you. So if you are interested in the Surgery Intellect free trial, as we're talking today, please pop along to this form and drop your details in there. Oh, look, it's so exciting. I'm shouting it from the rooftops. All right, great. That's enough of that. We're not going to talk about ambient scribes today, believe it or not. It's not the hottest topic of conversation around here. So I'm keen to understand, in my icebreaker for today, the big question, the one that's going to need a little bit more attention from you all. I'm keen to understand how many of you have adopted a total triage model in your practice, and further to understand why. So if you can, please pop an emoji of your choice in the chat if you're using a total triage model. And then if you feel like it, please elaborate as to why. I'd love to know. Whilst you're doing that, the usual bit of housekeeping from me. So I'm just going to tell you that the call's being recorded for prosperity and sharing. If you need to drop off at any point, you can do. You're not going to miss a thing. We know that you're all very busy people, so we're only going to aim to keep you for 30 minutes. Second of all, we love the questions. So as they come to you, please pop them in the chat and we'll get to them when we can. My name's Lucy Glynn. I'm the community manager here at Exon Health. And with me today is the rather fabulous Max Gatlin, fresh from his sick bed. We've dragged him in to talk to us. So be gentle, but do come with the hard questions, because he's here today to wet our whistle ahead of the GP contract changes and, of course, the swathe, if you like, of exhibitions that are fast approaching. Thumbs down, Rennie. What's that for? What was that for? I've forgotten what I asked now. Not using a total triage model. Okay, so that's the thumbs down to the total triage model. A thumbs up from Pauline to meet the contract changes. So you're going to love, I think, what's going on today and what's coming. So without further ado, Max, how are you?
I'm okay. Yeah, I'm. Yeah, as you can probably tell from my rather coarse voice, that just returning from sickness, but just in time to join you on this webinar, Lucy, which I'm very excited about.
And I couldn't be more delighted. Thank goodness, yes. All right. So, so what we're going to talk about today, intelligent care navigation. That's a new one.
It is a new one. So I know that over the last couple of years, well, today we're going to focus solely on voice agents. As everybody here knows, we run a series of webinars where we cover not only different products that Exon Health deliver, but also different features and functionalities within those. And at the top of this call, I just wanted to basically support everybody in understanding the concept of what we're trying to deliver at Exon Health. And I know that lots of people in the chat there, Sanjay talked about meeting demand, Paul Shapland about equity of access, and again, Pauline on meeting contract changes. Everything we discussed today is all to help you deliver more equitable access, not only meet contract changes, but also improve the patient journey and also the lives of your staff and teams as well, whether you're a GP surgery, a PCN, or larger if you're sitting within a federation or, of course, a regional team. The Intelligent Care Navigation System is here to support you and your operations, but also your patient and your citizens. So today, I will do a little bit of an intro into which of our products kind of make up the Intelligent Care Navigation System, and then we might dive in for about 20 minutes on the voice agent aspect of that, because there's lots of talk in the market at the moment about voice agents. What are they? Who's doing them? How do they work? And all of that. So we'll jump into a lot about the why, a little bit about the what, then also, hopefully, we'll get enough interest. People will see the benefit of how voice agents can be used to deliver equitable access and, of course, reduce demand coming into your surgeries. So I'm sure that at the end we can have a bit of a Q&A and potentially even set up a couple of demos with some of you lovely people. Is that okay, Lucy?
Very good. You've wet my whistle already. I'm quite excited about and thinking about all the different use cases where a voice agent could probably make a difference in a practice. So hopefully the audience is doing the same.
Absolutely, and actually that's exactly the first reason. On slide number 3, we'll look at other industries and where they're using voice agents, and hopefully that will get the cogs turning in some of our attendees' minds on how we might be able to utilise some voice agents within healthcare to support the challenges we've got. So without further ado, let's talk about the challenges we have. In primary care at the moment, we have increased demand. This is causing a lack of access due to our ageing population, dwindling workforce, and where patients aren't being seen within allotted time, they're having exacerbated health conditions or issues, and we know sometimes due to lack of education, they may present at hospital, and of course that adds strain on the system, economic strain, but where that strain is all going towards secondary care, we're perhaps not really seeing not necessarily just funding, but the time to reconfigure or change the way that we work in general practice to allow us to do the preventative care. So without having that focus and just constantly being slightly reactive rather than proactive, it's just compounding the problem. And at Exon Health, our goal is to improve the health of the nation. So it's the whole of the wheel that you see here, but where we're focused is really improving the access to not only general practice, but primary care as a whole. So if you think about the 10-year plan, moving from hospital to community, from sickness to prevention, and of course, analog to digital, which we've done a large part of with Surgery Connect, the telephony system, but now we're widening the scope of that to really support you across your whole system operations. So again, that's a very, very high level view, but I just want to hone in on the fact that we are here to support improving access to primary care services. To reduce delayed care or speed up time to care, and everything that we build, deliver, deploy, and work with you on tweaking and integrating is all focused around that. So I mentioned the Intelligent Care Navigation System previously. So what is an Intelligent Care Navigation System? So Intelligent Care Navigation System on the whole is it supports patient navigation through the health system, and the intelligence kind of leads into automated workflows, deep integration that is highly customizable, which means it suits you and the way that you work, but also your patients and how they need to access services, whether you've got voice enabled or voice activated for visually impaired, or you might need digital kind of chatbots on your website to support natural language, multilingual support. Everything that we do is to support patients and equity of access to services. So the products that make up the Intelligent Care Navigation System, and again, there's lots of subsets of features and functionalities within these. So if you are an existing customer, please do reach out to your customer success advisor who will help you switch on or configure these features. But starting with our flagship product is Surgery Connect, which I'm sure lots of you are currently using. We will touch on voice agents and our inbound, but we'll also look at outbound over the course of this webinar. Surgery Assist is a natural language digital assistant, which is locally trained to understand all of your local services. So it really helps a patient get to the right service first time before they enter the GP workload, essentially. Intellect is the hot topic. Thanks, Lucy, for giving it a shout out at the start of the call. I hugely encourage everybody to read the GOSH study, or the Great Ormond Street study, the benefits of introducing AVT. That covers largely secondary care, but with our exclusive agreement with Tortoise, we've brought their amazing technology into primary care, and you can get yours for free today by following Lucy's link in the chat. And then lastly, Surgery Insights. My belief is everything should be led by data, right from baselining to where we want to get to. It's all run by data, and that will help you iterate, tweak your systems and workflows to make sure you're delivering optimal care to your patients. So these 4 products are supporting us to deliver intelligent care navigation system across primary care. You can probably visit our website for more information on all of those, but today we're going to focus on the voice agent element, which of course is done by the phone, which is our Surgery Connect product. Okay, so I'll jump right in. Sorry, Lucy.
I was just going to give you a moment to clear your throat, Max, and remind everyone that one of those features in Surgery Connect that is absolutely crucial, and if nobody is using it on this call, they should be, is the phone bar. Now, just a quick litmus test. One in the chat if you are using the phone bar. Just make sure everyone's still awake and with us. Oh, you see, you've always been my favourites. Yep, absolutely. Good. And have you all told your friends about it? Because it's a fantastic feature and you should all be using it. That's my little plug for the phone bar. Over to you, Max.
No, brilliant. I think it does need emphasis, because everything that we're building from the system is born from the phone bar. So yeah, if you don't have it, please reach out to one of your customer success advisors to get it, upgrade it. It's very easy. It's done in 2 clicks. But everything that we build upon that will come from the phone bar. Thanks, Lucy. So yes, let's jump into voice agents. So what is a voice agent? It's a digital assistant that can work within phone systems. So it's all managed by voice. So it works on voice commands and can work to different degrees of complexity. So you might have a simple voice agent or a more complex voice agent that might do functions off the back of a command. So some examples of this in customer service. They're used to handle a high volume of inbound calls. So again, as I mentioned earlier, start getting the cogs turning in our brains about how we can utilize voice agents to solve some of our problems. It's already being used in lots of other industries in customer service teams to handle a high volume of calls. And these are trained to basically respond to frequently asked questions, check on order updates, status of deliveries, or even just signpost to other departments within the customer service team. Sales and lead qualification. So AI voice agents can actually do outbound calling. I received a call from Freddie's Flowers the other week. I used to be a customer 2 years ago. An agent called me, said, I noticed you left us back in 2023. Did you know we've got this new offer? So that's an example of an outbound voice agent, which we will come on to later. They can also book appointments. And everything like that. So there's huge use cases for voice agent in terms of outbound as well. In logistics and field operations, so workers in warehouses are actually using agentic AI and voice commands to essentially perform tasks hands-free. Again, slightly complex version that we probably won't be utilizing with primary care, but I'm just trying to step you through all of the different use cases from simple right through to the complex. And again, banking and finance, we've probably all spoken to an AI voice agent from a bank, or certainly been redirected by a voice agent from the phone call queue to speak to a chatbot such as Cora at NatWest to reorder our new bank card, for example.
Yeah, I don't like those ones so much.
So exactly. So as I say, there's lots of use cases. If we look at some of the problems they're solving in other industries, we can absolutely and should be looking to solve some of the problems that we're having within primary care as well. So let's make that a bit more relevant to primary care. So why should we consider voice agents within primary care? Sanjay mentioned at the start of the call equity of access. So what we should be looking to do is standardize the service that a patient receives, or the pathway a patient is taken through, regardless of the mode of access. And what I mean by mode of access is, are they visiting your website? Are they chatting to a chatbot? Are they calling in and speaking to a human, or are they calling in and speaking to a voice agent? They should have the same experience by whichever means that they want to contact. And again, even if they walk through the front door of the surgery, which is done less so these days, but they should still be met at the front desk with the same responses to the same problems that they're having. And I know we alluded slightly to total triage, and we'll come back to that in a moment as well. But what that does, if you have standardized or equity of access, it includes every patient and gives them the same level of access to the services that they need, regardless of their situation. So I've got a couple of examples on screen here around supporting visually impaired patients. So a voice agent on the phone would be able to support a patient that couldn't otherwise use a website or their smart device. Areas of deprivation where perhaps they use pay-as-you-go phones and don't have data on their phone. Of course, they can't use your online consultation tool or your website, so they might want to call in to submit their request. So this is an interesting one, and I was trying to get an accurate percentage or the data on this, because I know it's reported slightly differently from other companies, but essentially with a total triage model, what we're seeing is online consultation forms within the surgery are being completed by staff. Oh, sorry, 1 in 5 of them, or more than 1 in 5 of them, are being completed by practice staff, which means a patient is calling in or coming to the front desk, and the practice staff are actually having to spend the time to ask the patient the questions and complete the form themselves. And that's a huge amount of time when you look at the number of online consultation forms that are being submitted on a monthly basis. I've seen 10, 15, 20,000 forms being submitted every single month. That is a lot of forms. So 1 in 5 being handled by a human is just not the best use of a human or one of your team. We could probably take those off doing that and look towards preventive or proactive care. Or speaking to a human that needs to speak to a human, of course. This one comes on, again, this comes off the back of a couple of use cases working with a couple of partner surgeries over the last few months. They were speaking to some GPs that they adopted this total triage model, and the front desk were receiving the calls. They were speaking with the patient and asking the questions, but the patient in their, well, it doesn't necessarily need to be panic, but certainly knows their problem very, very well. And where they give a 1 to 2 minute summary of a problem or an overview of a problem, that staff member then may not have the time or the capacity or the skill set to type that quickly or that fast to take down everything that patient has said. So what's happening is that front desk teams are tending to use a shorthand, shorten it, or summarize what the patient is actually saying and putting it into the form. By the time that's then sent through to a care navigator or duty doctor, the quality of the submission is being impaired, which is actually resulting in the GP just calling the patient back because they're not quite sure what they meant when they answered the question. And it's that breakdown or effect in accuracy that is affecting the workflow, and of course just adding more work to your teams rather than reducing it. So by introducing a voice agent that could capture the whole patient input, there's so much more value in that when it goes through to your care navigator or your duty doctors that are processing those online requests. And that's a really important note to take. We're trying to deliver these solutions to support you in general practice and of course the patient as well. We don't want to be deploying anything that's going to disrupt the quality of the care that your patients receive. And that's why we should certainly consider voice agents. And then lastly, it's a scalable and cost-effective solution. So very simply, bit of technology can handle multiple calls at once. We know that a human can only answer one at a time. So if you've got patients that are happy to submit a request for a voice agent, for example, that could be done all at the same time at 8 o'clock by 10 people. And I understand that might open some people on the call up to slight concern about, well, I don't want to open up the floodgates, and that's why we then build it into XLO, which I'll come on to later, which can do signposting ahead of offering the form to be completed. So there are all sorts of workflows and protections or layers of protection we can put into place, and that's where the intelligent care navigation system comes into play. So again, just touching on, sorry for my voice, Lucy, perhaps it wasn't as good as we thought it might be.
You're a hero, Max, carry on.
But again, with the power of Surgery Connect, and I think this is the power of everything that Exxon delivers really is, and I always say this, it's highly customizable, deeply integrated, but easily usable. And it just comes to show when you look at your XLO within your Surgery Connect product, how you can drag and drop different tiles, menu options, IVR messages. You can change the voice. You can have 999 different hold music. There's all sorts of configurations you can do, but it's so easily done. And that's what we do and continue to do with everything that we build. It's deeply integrated and easily usable. So we've now got this new Xflow agent block, which is customizable, but I'll speak over the next couple of slides about how we're delivering it simply first, and then we'll build it with you to make it slightly more complex to release further benefits. But this new agent block that you can drag into your Xflow is so easy to use. You don't need to configure any calls going outside of your system. It's all within one system, which again has so many benefits when it comes to governance, data protection, auditing, and everything around compliance. But we'll come on to that in a little bit as well. But yeah, just wanted to show you that, as I said, there's so much benefit in delivering or building out one single system, looking at the patient benefit of the flow, no dead ends, and also as a practice from compliance right through to how your teams operate. That's the Xflow agent block.
Worth noting at that point as well that if you're not confident with the Xflow, because I know some people are quite intimidated by the array of blocks that are available, there is an academy. There are free courses on the academy that will help just guide you through how to get familiar and confident with the Xflow. Because when you are, my goodness, some of the intricate work I've seen from some practices on where those blocks fit in the workflow is quite impressive. So just a nudge for the academy on that one.
Yeah, no, that's really good. And actually, I'll come on to it in a little bit about how we're working with kind of these super users that really do understand it and they've had the time to really engage with the system and get the most out of it. And talking of developing a community where we can share that learning. And actually, we are looking to launch the lab, which I'll come on to in our final slide. But we really want to encourage shared learning across getting the most out of these products and features that we're building. So thanks, Lucy, for the nod towards the academy as well, which is absolutely fantastic. I spent a lot of time in there myself. So I've spoken about delivering simple solutions that realise benefits quickly, and I think there's you'll all have read or be aware of the AI paper back in May, where they talked largely about AVT and summarisation of conversations, and then medical device status and so on. What I do want to stress is that there are much simpler ways of unlocking fantastic benefits in your surgeries. We don't have to summarize everything and use generative AI and make it really complex and jump through several hoops of governance and compliance with our ICBs and delay deployment of these technologies. We can start very simple. There are little services within the artificial intelligence kind of framework that don't require all of these statuses to run through. Of course, we have all the associated governance and compliance, but we don't need to go to level 10 straight away. Let's just start at level 1 and build out and iterate. As we build trust, we will build the product with you as we build trust from yourself and your patients. And that's really important. And that is the approach we're taking with our voice agents. So in its simple form, the voice agent that we're delivering today is a voice-enabled conversation to capture a patient's query, clinical or admin, and delivering that into your surgery. It doesn't summarize it. It's very straightforward, and it's been hugely praised for the demos and the pilot sites that we've worked on up to date, and we can't wait to show you individually of how it works. The reason that we are not touching on a live demo today of webinar, well, there's the technical reasons, of course, the sound quality. I don't think you'll get much benefit from me doing it, but you will all work in different ways within your surgery. You all have different online consultation forms that you might like the agent to complete. You may have signposting technologies ahead of the voice agent within Xflow, like Surgery Assist, for example. So what we'd like to do is just sit with you. It may only take 15 minutes, half an hour. We can show you the voice agent, but have a conversation with you about where it can fit in and how it can best serve you and your patients. Again, I spoke about this at length and on every slide really, but everything we build is easy to use and configure. So it's all drag and drop, click button, drop down list, change the voice, make it work with you, and again meet the needs of your demographic. But most importantly, it's really important, and this is the crux of the whole of the intelligent care navigation system that we want to support you to build, is that we offer patient choice at every touch point, and that's really important. So again, if you think about a patient calling in, but they actually would rather self-serve online, how do we get that patient there in a seamless way? Or if they want to deliver it via voice, How do we get them there by the press of a button? Or of course, if they want to speak to a human, and then you're getting 100% demand and you might be splitting it out 33% down each channel. It's reducing the strain on you, but it's improving access for the patient in the way that they need to do it. Again, I spoke that we want to meet you one-on-one to talk about your existing workflows, and that doesn't change. Everything that we do in Exon Health is for you. We're not just about delivering one system and knocking everybody else out. We need to integrate with your workflows. And if there is a period of change or digital transformation, we're here to support that. But we're having more conversations at the moment about digital strategies. So we're actually working with PCNs and surgeries on where they want to be in 1, 2 or 3 years from now, and then we can work with you over time to do that. But again, we start simple and then we build it on. And there we go. I was a bit ahead of myself there, but we want to start simple and build it with you. There we go. Just goes to show how natural it is. But we want to ensure that everything we deploy adds value to you. There's 1 or 2 minutes. I'll just touch on this very quickly. There's 2 more slides, and I do want to get some questions in if we can, Lucy. So I'll flick through this relatively quickly. But the intelligent, so there's lots of point solutions out there at the moment. I want to stress that we're not the only guys delivering certain elements, but I believe there's huge value in delivering it from one single system or supplier. So think about the patient experience. It's just easier. There's no dead ends. We can do closed loop transactions where no patients fall between the cracks. One single interface that's deeply integrated. We work very closely with the large EPR providers, EMIS, TPP, and also, of course, Medicus. We have that level of integration to ensure the patient journey is smooth and there's no dead ends. Security governance, I touched on this. It's so much easier when you've got one supplier. You're not sending patient data between different systems. You've got it all within one system. And of course, we can quickly deploy fast proactive security protocols as well. And it's secure. Eliminate data silos. Again, I touched a little bit on any audits that you need through a patient journey. If you need to audit a certain issue or incident, it makes much more sense that the patient was within one system for the whole journey, and we know exactly where they dropped off. We're able to submit a request or not submit a request and pick that patient up where they fell off. And again, it's just simply, it adds more value. I don't want to use the word cheaper, but you're not picking up all the extra costs of sending the patient out to other systems. There's API costs in that. There's no economy of scale. It will just be more expensive and a bit more difficult to manage. If you've got 5 different solutions with 5 different contracts, 5 different suppliers, you've got 5 different renewal dates, 5 different billing dates, and 5 different invoices. So there's huge benefit and value.
5 different account managers and 5 different numbers to call if something goes wrong. Yes, I think that's a very valid point.
Yeah.
I too want to get to some questions, Max. So go on.
This, yeah, I had a note to this, not much more needed on this, but of course we're starting simple with the voice agents. But of course, if you have Surgery Assist, you've already trained it locally to do all of your signposting. That will soon be available via voice as well to ensure full equity of access. And then we are developing, of course, outbound and proactive agents. So using the example of the sales or lead qualifier that I used over in another industry, there's no reason why we couldn't do AI voice agents that are proactively calling your patient cohorts and gathering health data, such as blood pressure readings and so on. That is all to be announced very soon, but I guess we'll touch on best practice a little bit, Lucy, in our questioning.
I've got 2 choices now. So there's actually a great question from Omer about exactly what you just said and the kind of complex tasks that you anticipate the voice agent being able to do. For example, being able to book straightforward appointments such as smears, blood tests, immunizations, especially if it integrates into the clinical system. Ooh.
The answer is yes, absolutely. And I'd love to get, again, we've already developed them, but as we build it out and integrate it with more workflows, we'd love to work with you on what you're doing at the moment and how we can unlock further benefits. But absolutely, we would call that a functional agent, or agentic. It will perform a task for you or the patient, and absolutely, that's the direction of travel for these agents.
Question from Udin: is this fully integrated with System 1 yet?
Yes, absolutely. We're running pilots at the moment. So I will point you in the direction of our product director to keep you up to date on that. But of course, Lucy, I'm sure that we'll be releasing all of the results from the pilot. There's lots of blogs online that we'll be sharing on LinkedIn of the success of those. But we'll take the learnings, and if there's any tweaks or changes we need to do, we'll then build them into the product and make that change. But everything is scheduled to be launching, I believe, from Best Practice Show next month. There you go. I said it, Lucy.
Yeah, he did. He put it out there. I was told not to, but you can't stop this man. He just says what he likes. Right. I think that's a great time then to ask the big question, because Best Practice is kind of our pivotal exhibition of the year, where we do come big and we do come large and we do talk about all the things that we've got on the roadmap. So what can we expect from Exon Health at Best Practice, Max? What's coming?
So something completely new. So what we'll be presenting at Best Practice Show is we're presenting as the concept of the intelligent care navigation system. It will be largely interactive, or wholly interactive actually. We've got 4 different stations for the 4 different product sets, but within those we've got all the features and functionalities that we absolutely encourage everybody to come and visit us to try them out. And yes, we have phones where you can call these voice agents. We've got large screens for AI chatbots if you want to speak to our Surgery Assist product. We've got it all going on at Best Practice. I can't wait.
It's going to be big. Quick litmus test again. One in the chat if you are coming along to Best Practice, or are we going to have to wait and see you at one of the other exhibitions that are on the forthcoming list of events that are giving me palpitations? Whilst people are, well, not responding to me actually at this point, they've all fallen asleep, I think. One in the chat if you're coming along to one of these exhibitions, but whilst they're doing that, is there a timeline when the chatbot will be fully integrated into System 1?
That's a very good question, Edin. We are just creating a public-facing roadmap that absolutely we can share. I believe it'll be going on the website, and we'll communicate that. Lucy, might be an idea to drop that in the follow-up when we share the recording, just to share it with everyone on timelines. But absolutely, there are versions of these voice agents and chatbots that are integrated with all 3 of the clinical systems, if you like, across England and Wales.
That's a not so subtle hint as well, isn't it, really, as to things that are on the roadmap and things that are coming soon. He said it twice. If you want to watch the recording, you'll know exactly what I mean. In the meantime, that is it from us today. We have timed out and we are 2 minutes over. We hope you've enjoyed it. We hope you're as excited as we are as to what's coming next. Big thank you to Max for his efforts, because I know he's not quite 100%, and to all of you for your participation. Our next webinar is planned for the 22nd of October, so do look out for the link. I will send this one out in the next couple of days. If you would like any further information on anything we have discussed, please complete the form that is a little bit higher up on the chat, and a member of the team will reach out to you. We'll make this recording available, as I said, in the next couple of days. I'll put all the links in there as well. We hope to see you all back for more in next month's interaction. But in the meantime, we hope you have a very good rest of September, and we'll see you in October for more, possibly at Best Practice. Take care. Thank you.